make sure you start with the end in mind. So have your exit strategy as soon as you begin in business. Know how you're going to get out and know what your valuation model is of your business. At Paris Financial, we've been pretty good on allied health businesses now for probably 15 years, and we value them Australia-wide. We have a number of ongoing clients here at Paris Financial who are in allied health. So we're talking physios, osteos, podiatrists, other allied health, chiropractors, etc. We have a very specific valuation methodology with allied health, and I'll explain it to you in basic terms now. Take note of it because we think it's a really objective process. We've worked on it for many years, and if you're going into an allied health business, have your exit strategy in mind, and here's a really good way to understand the value of your small business in allied health. So here we go. This is how we value those allied health businesses. First of all, we will go through a valuation, an independent valuation of an allied health business by asking them 90 questions about that business. So there's got to be some rigorous due diligence asked for every area of an allied health business when we're doing the valuation. And that entails all sorts of areas of the business, including financial, HR, their operations, computer systems, location, etc. So that's a really important part of our process. For allied health businesses that have got higher than an $800,000 turnover, we would value those businesses on 3 to 4 times the EBIT. So 3 to 4 times the earnings before interest and tax. We would value a business with a greater than an $800,000 turnover. For an allied health business with a smaller turnover than $800,000, we would value those businesses anywhere between 55 and 70% of the turnover of that business. Now, what determines 55 or 70% or anywhere in between is the quality of the answers and the quality of the business coming out of the 90 questions we ask. And it is the same here for the EBIT model for businesses greater than 800,000. Whether you get a 3 or a 4 times the profit or the EBIT depends upon the quality of that business when we ask the 90 questions. That is how we value an allied health business pretty much anywhere in Australia. The 55 to 70% on turnover model is a very specific model applied only to allied health businesses. The EBIT model is a lot more widespread as a valuation model amongst small businesses, but that's the way we do it at Paris Financial. If you've got any queries on the valuation of an allied health business, just send us a little note in here and we can chat to you about it. But that's how you would look at your business in allied health, and you can use that model when you're bringing in a partner, an exiting partner, or if you're looking to sell on the open market. Remember your exit strategy when you start the business and know your valuation model. That's one for allied health. Enjoy. See ya.